Hello everyone, I'm Dr. Monica. Today we'll be discussing a very important topic, that is management of syncope in dental setup. Let's start by breaking down the word syncope. It comes from a Greek word syn meaning with and coptin meaning to cut or interrupt. It's a symptom defined as a transient self-limited loss of consciousness, usually leading to falling. In simple terms, the person passes out but only for a shorter time. The onset of syncope, it is typically sudden or relatively rapid. It happens quickly and also the person recovers spontaneously. And recovery is complete and it can be prompt. Coming to the key mechanism, it is caused by transient global cerebral hypoperfusion. Transient means it's temporary, that is, it does not last for a long time. Global means that it affects the entire brain. Cerebral hypoperfusion refers to reduced blood flow to the brain. So, in simple terms, syncope happens when the whole brain is temporarily not getting enough blood and oxygen, which causes the person to lose consciousness or falling. Also, when systolic blood pressure drops to around 60 mmHg, syncope is likely to occur. Coming to the symptoms of syncope, it is divided into three phases, that is pre-syncope, syncope and post-syncope. Now let's talk about pre-syncope, the stage just before someone faints. It is the period when the body experiences lack of nutrition and oxygen by inadequate cerebral circulation. Unlike the full syncope, the consciousness is not lost. One of the key signs in pre-syncope period is paleness or an ashen skin tone. The skin may also feel cool and moist, commonly described as a cold sweat. Common symptoms of pre-syncope include a sudden feeling of warmth, especially in the head and neck, lightheadedness, or a sense that you might faint. There is dizziness, or the patient may feel nauseous. Some people say that they feel bad or that everything is going dark just before losing consciousness, and fainting can also occur without any prior warning. Now let's understand what happens during syncopal episode. It is the period when the victim actually loses consciousness. So some key physiological signs to look out for include: first one is bradycardia, that's a slower than normal heart rate. Second one is hypotension, when the blood pressure drops. Next one is a weak thready pulse which is felt when checking the circulation. Unconsciousness, it results in muscular relaxation and there is possibility of an obstructed or partially obstructed airway due to a decrease in the muscle tone that can cause the tongue to fall into the oropharynx. Another effect which we can see due to muscular relaxation may be fecal incontinence. Now let's move on to the postsyncopal phase. In this phase, the patient regains consciousness and we see that the vital signs such as the heart rate, pulse and most importantly, the blood flow to the brain, it returns to normal levels. So during this recovery phase, the person is still at risk of fainting again. So this can happen if the patient is raised from supine position too quickly or if they are asked to stand or walk too soon after the recovery, or if the patient sees a syringe, blood or blood stained cotton, especially if that's what caused the fainting in the first place. So it is very important to let the patient rest for a few minutes, sit up slowly and keep the environment calm and reassuring. The most common cause of syncope in dental office is fear and anxiety. In young people below 35 years, it's usually vasovagal, situational, psychiatric, and sometimes undiagnosed seizures can also be a cause. In the middle age group between 35 to 65 years, it's vasovagal, but cardiac causes like arrhythmia start to appear. In the elderly over 65 years, it's usually multifactorial. They can be cardiac issues, orthostatic hypotension, medications, and they can be neurally mediated causes present. Now coming to the systemic management of syncope patient, The initial approach includes careful analysis of the symptoms, clinical findings, and the past medical history as described by the patient or other observer. So we must pay attention towards the characteristic and the length of the episode, patient's age, patients and witness accounts, if there is present of any concomitant disease, the circumstances, situations surrounding the episode, the body position, posture and the emotional state, the family history of the patient, the medications taken by the patient, especially like antihypertensive, anti-anginal and antidepressant agents. Now coming to the management of syncope after the initial evaluation. First we focus on the positioning of the patient. First the tight clothes should be loosened and the patient is made to sit in the Trendelenburg position where the patient lies flat on their back but the legs are raised higher than the head. This helps blood flow return to the brain more quickly. In case of a pregnant lady, the left lateral decubitus position is preferred. This means that the pregnant patient lies on their left side, which helps reduce pressure on the inferior vena cava and improves circulation, which helps in preventing the syncopal episode. So after positioning, we try to give relief from compression on the neck. Try to revive the person by tapping briskly and evaluate and maintain the airway breathing and circulation. If absent, we begin with the CPR. If the person is breathing, we restore the blood flow to the brain by raising the patient's leg above the heart level, about 12 inches if possible. Then we give supplemental oxygen. When patient regains consciousness, he or she is kept flat and reassured, and if the patient does not regain consciousness within 1 minute, we call the emergency number. Once the pulse and the blood pressure recovers to normal, slowly we raise the patient to a seated position. So after this, we can give fruit juices or glucose water to the patient until the patient recovers completely. So the patient who have any significant medical problems or the syncope is prolonged, complicated by seizure activity, immediately we have to refer the patient to a hospital for further assessment. So in case if the recovery from syncope takes longer than 5 minutes after positioning and or if complete recovery does not occur in 15 to 20 minutes, the patient is surely referred to the hospital setup. Please like and subscribe to this channel. Thank you.